Yeah. So how do you titrate your expectations? How do you moderate your expectations, and what you should expect? So how much is enough? Uh, there are patients who come to us who say, or their relatives come and say, they bring their parents and say, I don't want my mother to be bone thin. Even if she loses 15-20 kg weight loss, that should be enough. And I have seen patients who say, before surgery in a consultation, even if I lose 20 kgs, I think I'll be good. I have never lost even 5 kgs with diet. And then when they have lost 30 kgs, they say, oh, I have lost only 30 kgs in 6 months. I should have lost more. So the things change. And then there are people who know that their ideal weight is 65 kgs but have a very high target, and they say, uh, can't I be 50 kgs? And which is all fair. People have different expectations, so I'm not saying that there's anything wrong about it, but people have different expectations, and surgery is the same with most of them. So most of the time we do not decide surgery on the basis of weight loss that you are expecting. We decide surgery on clinical parameters, and then we give you the options, that why we think that you should have a bypass and not a sleeve, or why you should have a sleeve and not a bypass. Because we have found that weight loss could be similar in both the surgeries depending on how you follow up after surgery. So whether it's a sleeve or whether it's bypass, and weight loss is almost similar. Some people have done wonderfully well with sleeve, some people have done wonderfully well with bypass, and so expectations uh, are a different ball game. Usually, we expect you to lose 60 to 80% of your extra weight in 12 to 18 months. So that means if your extra weight is 50 kgs, you should be looking at losing between 30 to 40 kgs. Now, this 60 to 80% is not because you are doing something wrong or you have not been very good at follow up. This difference is basically because of your age, because of your mobility. Some of our patients have severe joint pains or other diseases, and they are not able to exercise well, and thus uh, it has to be acceptable. There is nothing wrong, nothing to feel guilt about. That, see, I saw in the support group somebody has lost 80 kgs and I only lost 60 kgs. Now one has to live with it, because you are at a certain age. uh, as, if you were at 18 years of age, you would have probably lost 80% of your extra weight, or maybe 100% of your extra weight. So it is better to accept where you are, and to live with it. And then lifestyle changes not only enhance weight loss but helps in maintaining it. So surgery is not a magic wand. I show it in so many of my presentation. The real magic is in you. And that's why this bariatric surgeries are generally not offered to people who are gaining weight for a short term, because they have not struggled enough to earn this surgery. People who have struggled enough, and almost 99% of our patients have been to gyms, have been to various weight loss centers, and are still not able to lose weight. So they know that surgery should be used wisely as a tool, and if they change their lifestyle, they can maintain it lifelong. So the tendency to gain weight remains even after surgery, because it is what most of us have inherited. Even my family has a tendency to gain weight, and 4 of my family members have undergone bariatric surgery. So I know that how difficult that tendency and how dangerous it could be. So unless you make a lifestyle change, you will not be able to beat that tendency. Now, besides weight loss, as all of you know about bariatric surgery, you have control of many diseases like diabetes, hypertension, sleep apnea, joint pains, menstrual issues. and they are likely to remain well controlled with lifestyle change. So, this lifestyle is the running theme through the slides today. But what you need to realize is that they are controlled, they are not cured. There is no cure for diabetes, there is no cure for sleep apnea. If you are well controlled, please, we are very happy about it, but there may be phases when you may, it may raise its head up again. It's like diabetes, your sugars are normal, but if you have a urinary infection or if you have a pneumonia or any kind of infection in the body, the sugars can go up. If you are running through a lot of stress because of your business issues or anything else, or a family issue, the sugars can go up or the blood pressure can go up. Be very mindful of it, because you should not remain untreated. If you have infection and your sugars are high, tell your doctor that you have diabetes, which was controlled with the surgery, but now probably the sugar is high and it's time that he starts your treatment for diabetes again. Nothing wrong. When your sugar, the infection will get controlled, the sugar will also get controlled. And that applies for all of things. So please get your tests done regularly for these diseases, and generally we advise you to do that when we discharge you, to diagnose it early and to avoid these undiagnosed or untreated phases. Now, besides the disease, most of you have experienced it, that you are able to walk better, maybe able to run also. The breathlessness is less. But what we are discussing in every Friday seminars, that this not only reduces the disease, it reduces the risk of heart attacks, brain strokes, cancers, and infertility. And these benefits last very long if you are able to maintain weight. Now, I'm not saying that if you have gained 2-3 kgs, 5 kgs, these things will come back. Certainly not. But if you are not able to maintain, then this is a problem area and it should be avoided. So how do we do that? And then, because you lost weight, you are accepted as an achiever in your society, in your office, in your family, and it improves your work efficiency and more responsibilities are given to you. It also helps in reducing stigma attached to obesity, and you know it better than anybody else, that what were the problems faced by you when before surgery, when the weight was significant. But please remember, those who are closest to you have seen you closely, and that subconscious stigma may persist in their mind. And if you fail to maintain your weight in long run, that stigma comes back. And some of my patients have come back and told me that my sister said, I knew it, nothing will work for you. Even if you get surgery done, your weight will come back. So you need to prove them wrong. And I'm not saying that you need to do something extraordinary. We will talk about it, what you need to do to avoid these situations. And then it also increases your acceptance in society. It improves your confidence. You have more friends and maybe more relationships. But please realize, those people who stood by you when you were in trouble, when you were struggling with obesity, because these are the people who gave their shoulder to you at that time, and they are the friends, they are the real friends. And please remember them and keep them close to you. So friends, it is all about expectations. Your expectation and our expectation as bariatric team. Your expectations are to have early weight loss and substantial results. Now, this is almost similar to what our expectations are: substantial results and sustained efforts. So 50% of our expectations are common. It's just that your early results expectation and our sustained effort expectations have to converge. And that is possible and it's achievable. They are not very difficult. They are simple expectations and we can bring them together to have long-term results. So I am very happy that you are happy to lose weight. I am very happy that you feel confident and you are living your life to the fullest. But please remember, these results are early. They can only be sustained by working closely. I know so many of you who attend these support group meetings. Support group meeting is one of the ways to improve your longevity of your results. So do that, because living up to expectations, your own expectations, does not happen automatically. Habits do not change just because you had surgery. So I always keep saying, if I'm used to eating a paratha or bread with the butter in the morning, uh, all the talk by my nutritionist is not going to change that. After a year, when you have reached your best weight, you will go back to parathas and to bread with butter automatically, because this is what you have inherited as an environment from your parents or from your family. So you need to change it. You need to make effort to change that environment permanently. If you don't change that, then you will fall in your own eyes, because you will not be able to live up to your expectations. So living with expectations is not easy. You need to make effort to change your habits. Please remember, and this happens very frequently. Patients come and ask me or my nutritionist, when will I be able to eat normally? Now, your normal may not be the right normal. Your food habits may be unhealthy. Knowingly or unknowingly, you may think that they are healthy, they may be unhealthy. So it's a good idea to ask questions. Ask questions even if you have undergone surgery. Send your questions, send 10 questions, 20 questions. I'm eating this today. Is it right? This has a little bit of white flour in this, or refined flour in this. Is it right? I'm having a fried item. So you know most of the things, but you need to make a change to, because your unhealthy food habits are not right. And please remember, all those people whom we adore as being healthy, maintain a healthy diet for life, and that's how they are able to maintain their health. So please change your unhealthy habits forever, not for just 3 months, 6 months after surgery. This has to be changed to live up to expectations. Alcohol and sweet consumption. Now, why they are specifically target? Because they hardly have proteins and they have multiple issues. Alcohol, because they don't give you fullness. Alcohol is like drinking water that goes through, and it gives you lots of calories, not only because of alcohol, but the Indian habit of eating snacks with the alcohol, which are all unhealthy snacks. So alcohol is bad for your weight. Alcohol is bad for your liver in long run. I'm not saying that completely stop, but if you are having alcohol on a daily basis, make it once a week for 3 months and maybe once a fortnight after that. And it's doable even in lockdown. Even if you have all the alcohol available in your bar, you can do that. Sweet consumption. Sweet is the worst part, because sweet uses only maida or the white flour or refined flour. Sweets uses sugar, and sweets are generally fried. So everything that is there in a sweet, that is the way it is made, is unhealthy. The only way you can make healthy is by cooking it yourself and seeing that it is a healthy sweet, and you can have it maybe once a week. Fruits are also sweet. So if you have a sweet tooth, probably try a bit of mango one day and a bit of apple another day. Uh, that at least reduces the calories. I'm not encouraging sweets every day, but if you cannot live without sweet after every meal, you need to cut down on calories that are coming through sweets. And then the hidden fats. Now, this is again, as Dr. Apratim was saying about oil, this is an Indian obsession about milk products. We drink milk, and my dietitian advises milk to a lot of patients because they are vegetarian and they do not have many good protein sources. Milk have almost 7% fat. So if you are having full fat milk like how people drink in Mumbai, Goel milk, which is 7 to 9% fat. So if you are having, if your family is consuming 1 liter of milk a day, you are probably getting 70 to 80 gram fats through your milk between 2 or 3 of you, which is very, very high. So I think milk products, if you want to have them, I also have them, then you need to have them with the skimmed milk or double toned milk. And then mislabeling, the somehow the government industry are in a situation where they are fooling each other, and or they are working together. The labeling and is done in a way that the consumer is never able to get the real information. So please spend time. And that's why my mindful buying, when you go to the departmental store, and I have learned it from my son and my wife, they spend time in picking up every product, going through the label, and keeping down a product which I would normally pick up very easily because it looks nice, and identifying something which is healthy. Because unless you buy healthy, you will end up eating the wrong food. So I think mindful buying and mindful eating both are equally important. And they are very important, because if you will not do that, no surgery is going to work in long run. They only work if you are working with the surgery, the tool that we have given to you. A quick word about exercise. So I see patients who come to me and they say, we have been working out 2 hours a day or 4 hours a day. Some youngsters have been going to gym for 2 hours in morning, 2 hours in evening, and they were not able to lose weight. They were so motivated. And after surgery, after 2 years or 3 years, you talk to them, what is happening about your workout? And they say, no, I feel lazy. I go to parties frequently now, and it's late, and I cannot exercise. This is not acceptable, because this is an important component of maintaining weight, and we have discussed it with every patient. Exercise helps in maintaining weight. Exercise have hardly any role in weight loss. So the way I was never exercising till I was 56-year-old, and last 4 years I have started exercising. You should start enjoy exercising. Make friends wherever, whether you are walking in your building, sit with them, talk to them when you are walking around your building, or walking on a sea face, or you are going to the gym. Make gym a friendly place where you make new friends every day, find out about their habits. And I have found only those people who are friendly in a gym are coming regularly to gym. They talk, they know each other about their families, about their businesses, about their film releases. They give compliments to each other, and they receive compliments in turn. And that is how they enjoy success. So I think exercise can only happen if it is like eating healthy food. If you start enjoying healthy food, if you start enjoying exercise, then only exercise bring results. So I think these are the way to live up to expectations. Most can lead a healthy and fit life with identified lifestyle changes. So I think, friends, you have taken a major decision. I can tell you 99% of the population, at least in India, will not even get an appendix surgery done, or a cyst removed from their body because of the fear of surgery. You are all brave people with a strong willpower. Many of them will not be able to take a call like that. And after doing that, if you fail it, or if you fail yourself, that's not, and it's not generally not the major things that fail you. These are the minor issues in the term of avoiding a sweet, avoiding a drink. Learn to say no. Learn to say no to your friends, to your family, and say, I don't want to eat this.